All right, lactulose is actually kind of a cool medication. I know that sounds weird to hear me say if you know what lactulose is, but I really like kind of the pathopharm of lactulose. So the indication for lactulose is actually constipation or hepatic encephalopathy. Okay, so what hepatic encephalopathy is it's a condition caused by the liver that causes neurological changes. And what causes that neurological changes is buildup of ammonia. So protein will come in, protein will go into ammonia, and if our liver isn't getting rid of this ammonia, we will actually cause this buildup of ammonia in our bloodstream, which will cause neurological changes or encephalopathy. So the way that lactulose works is it draws water into the stool and softens the stool. And so by doing that, it helps with constipation. What it also does is it inhibits ammonia from passing into the colon. So if ammonia gets into the colon, it's going to get into the bloodstream and continue, with this encephalopathy. All right, by giving lactulose, we can actually draw ammonia into the colon and make it pass out with our stool. And that will help to resolve this hepatic encephalopathy by bringing down our ammonia levels. So therapeutic class is laxative, pharmacologic class is osmotic. It's used with caution in diabetes mellitus, and it can cause cramps, abdominal distension, and hyperglycemia. We want to assess our mental status and ammonia levels. So if we're giving it for hepatic encephalopathy, we want to closely be monitoring our ammonia levels. Did it actually work? Did it bring the ammonia down? I've seen patients with ammonia as high as 300-400. We give lactulose and it helps to bring it back down to where it should be. The patient should be averaging 2 to 3 bowel movements a day if we're giving it for constipation. If our patient isn't constipated but they have these elevated ammonia levels, we're going to see the patient having a lot of stool. Now, that's not the part I like about it, obviously, but I like that pathopharm of it, of how it can get this ammonia out and resolve a neurological issue. I think that's just really cool how the liver, the brain, the bloodstream, the colon all play in together to resolve this hepatic encephalopathy. So you'll see patients go into the ICU who might be in hepatic encephalopathy, meaning they have this rapid decrease in neurostatus. No one knows what's going on. We get them in the ICU, we run this full blood panel, we realize it's their ammonia level. The ammonia is what caused it. They're a liver patient. We realize their ammonia is highly elevated, and so we start giving them this lactulose, and it can resolve pretty quickly. We'll see it actually resolve pretty quickly. But what will happen is if this ammonia continues to rise, the encephalopathy will worsen, and we'll see like our respiratory drive decline, and we'll see our patient's response declining. And so it can be kind of a scary state. We might end up having to place them on BiPAP, and then we get all this ammonia level fixed with the lactulose. So that's really why I've seen lactulose given most often. It can be given for constipation as well, but what I generally have seen it given for in ICU and in step-down settings is to resolve these elevated ammonia levels. All right, so that is lactulose. Think ammonia, think liver, think stool, and that's going to help you remember lactulose forever. This has been another episode of the Nursing.com MedMaster Podcast. My name is John Haas, RN, CCRN alumnus, and I want to give you our free download of the 50 most commonly prescribed medications. To get that free download, just go to nursing.com/50meds. That's 50, nursing.com/50meds. We love you guys. We want you to succeed. That's why we provide clear, concise, and visual supplement for nursing school and the clinical floor. We love you guys. Go out and be your best selves. Happy nursing.